The future will deal with a very complex disease. Of course, the combination of low aggressive surgery and medical treatment will be the future. There is no competition between medical treatment and surgery, but surgery can do nothing alone. So surgery will promote a best outcome for medical treatments. And in the last 20 years, the surgery became less and less aggressive, try to leave the mucosa over the bone intact, try to promote the self-cleaning of the cavities, of the sinuses. And the recent advances in the immunologic studies and with the new monoclonal antibodies, with the new molecule, to reduce the chronic inflammation, has a joining effect with the surgery. So the target of the surgery still remain the clearance of the pre-chamber, the clearance of the ostia. And the way we will do surgery will be less and less aggressive. We have a new device to reduce the heating of the mucosa, the heating of the bone. New device for remove the affected bone, reducing the granulation we will have post-surgery. So this new device leave better the field and promote better the medical treatment. And there is a new trend to bring the different drug in contact with the mucosa, so with the irrigation. And to having that, we need a clear ostia to break the biofilm, for instance, to self-cleaning of the patient. And this is a very good joint effect between surgery and medical. So it's really a revolution, because in the past there was a competition. We observe a lot of paper in the past with the comparison between medical and surgical treatment. Nowadays, it's really a joint venture.
We will move towards more minimally invasive surgery over time. I think that most of us feel that at this stage, balloons are not a good treatment for really well-established chronic sinusitis, that they're probably an alternative for minor disease that perhaps you could treat also medically. But when it becomes really established, they're not good. But if we could combine balloons with anti-inflammatory therapy and remove the small bony partitions, then I think we might be able to move towards more minimally invasive types of intervention. Other things, obviously topical therapies have come a long way. Nasal irrigation is really now standard. Nasal irrigation with steroids is really very common. That's played, I think, a significant part. In the future, looking at the race is on now in terms of the microbiome to try to identify protective bacteria, and that would be a very exciting area if we could identify what are protective bacteria within the microbiome in the future, and consider therapies from that standpoint. And then for really severe disease where it's combined with asthma, then I think the monoclonal antibodies are very exciting, and that's another area to look at, you know.
It's very hard to make predictions, especially about the future, but certainly the upcoming monoclonal antibodies will give us both new therapeutic options and will help us understand our management of the disease better. But I would say that beyond these, looking into the future of the pharmacologic industry, will be again agents to modify the barrier itself, either by specifically targeting elements of inflammation which hamper the healing and regeneration of the sinus mucosa, or by encouraging directly the regeneration from the basal cell up, and this can take any form, from stem cell therapies to stem cell-derived products to therapies we haven't even begun to dream about, but which may be present in other areas already.